everyone, my name is Aman Rangi and I'm an occupational therapist. I wanted to share some uplifting mental health strategies and some stories from some of my clinical experience. So currently as a clinician practicing in the community, I work in private settings as well as having extensive experience in our public healthcare system on inpatient psychiatric units, outpatient centers. And throughout all my time, I've worked with a lot of individuals dealing with mental health challenges as well as physical issues. And I wanted to share some insights from my background as an occupational therapist that can be helpful to different individuals. So as occupational therapists, what I'm concerned with most is how someone spends their time. So broadly, we use the word occupation to define any meaningful life activity. And for most of us, a big part of our occupation is going to work, going to school, and contributing to our community. During this uncertain time, a big challenge that's happening right now is for most of us, our occupations are being affected. And why does that matter? You see, our occupation adds meaning to our lives, and we drive a lot of our identity from what we do to contribute to our community, to provide value to those around us, and to provide meaning for ourselves. And right now, a lot of us are sitting at home. And there's a lot of scary terms being used in the media right now, but a big thing that I'm seeing a lot of is this big focus on social distancing. And that's really important for obvious reasons for infection control. But what I really want to talk about is that social distancing doesn't necessarily have to be emotional distancing. So when I worked in inpatient mental health settings, when I would do an assessment to determine someone's risk, we would look at certain risk factors that would predispose someone to be a higher risk for a mental health issue. And two of these would be social isolation and lack of social supports. And right now, this is similar to what we're being told to do for infection control reasons. But that doesn't necessarily mean we have to distance ourselves emotionally from the supports around us. I'm seeing different people doing things like using Zoom or using so much of this technology that we have at our disposal to allow ourselves to be more connected with individuals. A big thing is talking about some of these challenges. So there's a huge stigma around mental health in general, and I've seen through experience that when a lot of individuals are struggling, we don't reach out for support. But right now, we can use this experience to bring us all together, because in some way, shape, or form, we're all dealing with something. And by talking with each other, by creating awareness and having a conversation around this, we're helping each other and we're helping ourselves. So that's one strategy that I want to share. Just make sure to do it through, I would encourage like Skype, Zoom, or FaceTime, just because then you still have that personal touch of seeing the person's face. And it's very similar to actually connecting in person. It's, I guess, the second closest thing. Another strategy. So when I was talking about how occupations add meaning to our lives, for most of us, we have nothing but time now. And a major thing with time, it has a direct correlation on how we use our time, has a huge impact on how we're functioning in our daily lives. So when I worked in inpatient mental health settings, I would do a 24-hour day in the life of, and I would look at how does someone spend their time. And when I worked with individuals who had things like depression and anxiety, it wouldn't be a surprise that they weren't really spending a lot of their time doing meaningful activity. There wasn't a lot of structure to their time, is what I mean. So one thing that you can do to make yourself most productive and feel like you have some semblance of a routine is to establish one. So you can send me a DM and I can share some resources, but essentially even just taking out a piece of paper and broadly scheduling your day. So you have different periods of time for when you're waking up, what you're going to do to spend some time on yourself physically through exercise, spending some time to do some other emotional resources, such as time with each other, such as journaling, reflecting. There's a wealth of resources available now online and through various organizations. But by structuring your time, you're ensuring that you're spending it wisely. And the last, more tangible strategy, right now, I think most of us would agree that when life is busy, our physical environment takes a hit. So what we can do is use this time to declutter our environments. Organize your room, organize your garage or your living spaces. Oftentimes having a physical environment that is free of clutter is going to help us have more mental clarity and free up some mental real estate as well. So please, these are some strategies that you can use. Please share this with anyone else who might benefit. And above all, nobody should feel alone during this time. So provide support to each other, as well as by limiting that infection control as well. But provide support to each other, give yourselves time, and use this time to focus on yourself and maybe do some reading as well and other strategies that are going to help you cope better. Thank you, everyone. Have a great day.